All right, let's talk about full compensation. Full compensation means your body has done enough to equalize you back out. So your pH will always be normal with full compensation. Your CO2 and your bicarb, if all three values are normal, it's just normal. If your pH is normal and something else is not normal, you have to call it fully compensated. So let's make a normal pH. Let's say 7.36. So pH is 7.36. We will say the CO2 is 58. And my bicarb is 40. Okay. Let's name it. So we already said the pH is normal, right? 7.36. So my normal range is 7.35 to 7.45. This would be really close to that acid side, but it's normal, 7.36. So pH goes here in the normal box because it's normal. We have a CO2 of 58. So what box do I put that in? Our range is 35 to 45, and we're talking about 58. 58 would be way over here, right? So that is on the acid side. So I'm going to put CO2 in this acid box. We have a bicarb of 40. 22 to 26 is my range, and this is 40. So that's on what? The acid, normal, or base side. My range is 22 to 26, and we're at 40. So that goes in my base box. Now you may be wondering, well, Mel, there's nothing in the grid underneath pH. How the heck am I supposed to know what I'm in? Great question if you asked yourself that. I start differently. If I see my pH is in the normal box and something's going awry down in the other values, I can start by saying the compensation. And in this instance, I can start by saying I'm fully compensated. I'm running out of room here. Writing tiny, sorry. I'm fully compensated because my pH is normal. There has been enough shenanigans on the acid and the base side to pull me into equilibrium, into homeostasis there. So my pH is normal, and these guys are not, so let's call it fully compensated and start there. When you do that, the second step is to go back and look at your pH and see, is that pH leaning more towards my acid side or is it leaning more towards my base? So if your normal range of pH is 7.35 to 7.45, your midline is at 7.4. So you could think of it that way. 7.4 would be right in the middle. Or you could just say, okay, is 7.36 leaning more towards the 7.35 side, or is 7.36 more towards my 7.45 side? So you should be saying to yourself, well, 7.36 is right next to 7.35, so that's leaning more towards my acid side. So because it's leaning more towards my acid side, you tentatively can move that pH here to name it. It's like a fake out. Helps you name it. Because it's leaning more towards my acid side, I tentatively put it over here into my acid box because it's leaning that direction anyway. So I know then I can call it acidosis. And for my grid, I look underneath the pH to see what's underneath my pH here. Respiratory, right? CO2, respiratory. So I'm in fully compensated respiratory acidosis. Again, go back and rewatch that if you need to. The more you practice, the better off you are going to be in the long run. I promise you that. So I will, in the description, talk about where you can find a practice ABG sheet. I'm also going to link my favorite ABG practice sites. I highly recommend going and watching my other ABG video that says ABGs explained. That's not talking about how do you calculate it. That's talking about the ins and outs of what it means in real life, the signs and symptoms that come along with it, causes. Once you understand that, you will be so much better off in the long run. I hope this helped. If you're still having trouble, email me. We can set up an appointment. I'd be more than happy to work with you. Okay? Best of luck to you. See ya.